Good evening, everyone. I'm Dr. Aditya Sethi. I've been given the task to ask you if your staff should multitask. So let's get into it. Our daily lives or of our staff is quite like this lady right there. It's a little bit here, a little bit there. But the question is she efficient? Is she time efficient, or is she being inefficient here? So that's what we're going to ask and answer. So the first thing I did when I got to know about this topic, that I've got this topic, is I Googled multitasking in hospitals and what does it mean. So it refers to physicians, assistants dealing with more than one task simultaneously over same period of time during surgery. Sounds very scary, doesn't it? Or as a patient, or in other operations of healthcare system. So it's a complex, it's a big challenge, and has esteemed importance. Being a little complicated, it has a double-edged sword. So what are the pros and cons? The pros could be it's a cost-effective method of making your human resources meet your requirements. Good time management can be achieved with good multitasking. Less man management is required because obviously if you're multitasking staff, you don't need to hire so many people, and increased responsibility is good for the growth of the person and the institute. But what we are forgetting about is the other side, that whoever multitasks at that moment of multitasking, their IQ drops close to 10%. They're not attentive to what you want at that moment. There's loss in productivity, close to 40%. There's an attention span drop in attentive blindness. Blindness is what the studies show. I'll show a video of that if I have time. And rate of errors go up. So the good, the bad, and the ugly of multitasking. So before we make a decision, it may be very wise to ask yourself to do some pros and cons and ask yourself these questions. Does it make sense to get the new Gen Z, because are they better multitaskers with their phones, with their lives, with everything else? No, multitasking means loss of time. Is that a misnomer? Brain processes one information at a time. So is it actually wise to have multitasking as the main work? The guy at the reception who's also selling you glasses, who's also selling your pharmacy, and he's also trying to get the patients comfortable. Is he actually doing a good job, or are patients are getting angry with him? Switching to and fro from one task to another, is it a really efficient manner or a misnomer? So the bad. Studies show multitasking actually prolongs time taken on each task. It results in poor quality work, and that is comparative to somebody who's monotasking. And is it really good management of time, or do these people actually take longer in finishing the simpler tasks by multitasking them? And do the results seem inferior? And what about new Gen Z? They're comfortable with tech. They already are multitaskers. You never see them without their phones. You never see them without their AirPods. They'll be doing a lot of things already. They have a high self-esteem. They have a sense of entitlement which goes against them, and quick to rich, ambitious. So why do we prefer multitasking? It's a cost-efficient method of getting work done. Multitasking with technology comes second nature to these Gen Z, and it stimulates creativity. That's one of the main things about multitasking, and reduces the idle time, which often can be known as the devil's workshop. It reduces free time, enhances skill development while they could have been just loitering around or not doing their work. You've given them another job which makes them think, which makes them go ahead and do something, learn something new, and can make and this makes a good multitasker indispensable to your workforce. If they are very good at their multitasking, you may want to hold on to them. You may decide that this is the person to lead your practice or be with you during your practice. And motivational multitasking, it can be, there's various theories behind it. Self-efficiency, the person feels he's very efficient and very responsible. And expectancy theory, which is they expect that they are essential to the system. So controversies, one research suggests multitasking is a big illusion. This big illusion being they think of them as highly productive and motivated, even when they might not be. And though it seems time efficient and productive, and often multitasking leads to high stress levels and low productive outputs. For example, while you're working in your clinic and suddenly another patient walks in and asks about his prescription, and the phone rings and something else. And like Sir said in this first talk, somebody asks, says that optometrist will not come, or you're in admin and things just blow out of proportion and you may forget to write that prescription correctly. So multitasking, is it a success? So negative effects of multitasking seem to outweigh benefits when the person is responsible for complex activities. Could be a doctor, could be an OT nurse, could be an OT tech. And doing two or more things at one time adds stress, reduces ability to complete one task to the best of our abilities and to perfection. And often that leads to demotivation, rage, poor social skills, errors. And the results can be vary when we're talking about complex activities. Is it asking too much? So there's actually been a study on this topic, and Professor E. Miller, who's a researcher, compared simple task multitasking to complex task multitasking amongst professionals and found simple taskers to be better off at the job in long term. And mental health also takes a hit when dealing with complex activities. You're already stressed, you're already on high levels, and you're doing complex activities. So suddenly you feel a little guilty. I could have done better. I could have done that job better. And there can be always low panic levels in these people. That leads to high levels of cortisol, stress in multitaskers, and they often age faster. So this is the video I was talking about. Let me see if I can play that for you. There we go. So I want everybody to pay attention and see this video from Siemens and Chavez.
This is a test of selective attention. Count how many times the players wearing white pass the basketball. How many passes did you count?
So how many passes? Anybody with a guess?
The correct answer is 15 passes.
But how many of you saw
I counted 12 actually. Yeah.
How many of you did you see the
I
gorilla?
saw the gorilla. Yeah, I did.
Yes.
We have some good efficient multitaskers amongst us.
We all thought that you were going to ask something on the gorilla only, dude.
This video is from research by
Clearly the presentation is not for you guys.
No, but I counted 12. I didn't count 15. Yeah. Maybe I was seeing the gorilla at that time. Yeah.
Multitasking leads to problems. See? And to be more specific in ophthalmic setup, when do you multitask in your day? Busy practices. This can test your multitasking abilities. You're running late. Like we had a post in our WhatsApp chat, running late, put me later. Long queue to see you. Various examples can be said. And this all leads to brain frazzling experiences. The upside from multitasking in ophthalmic practice, multitaskers can be better at integrating information and better at their jobs. Like we had everybody answer that question very well. We become more efficient, we become time conserving, and all we have to do is manage this well. We often can be stress absorbers. So when you have these problems in the OT, we are much cooler than somebody who doesn't multitask. And the jack of all trades employee or employees can be useful for private practitioners, small scale institutes, charitable trusts, rarely institutes of large scale. They can also be useful there. So the key is organize first, multitask later. The key word is organize multitasking. List out where you could be caught multitasking. Watch out for the switching gears, that brain moving from one task to the other and forgetting about the other. Fact, the more you do, the better of multitasker you become. And fact, multitasking is one thing, unrealistic workload is another. That means if you have lots of things on your plate, you may not be a very healthy multitasker. So is it really a multitasker who we want? The idea of having an employee who can multitask is something that seems to be forgone. In the era of specialization, it may be more beneficial to have monotaskers rather than multitaskers. And multitasking is still a demand for all companies who hire individuals. But what they really mean is someone who can avoid switching between tasks. They can finish their task properly and then go to another task, which often can be called as multi-monotaskers rather than multitaskers. That means they can finish multiple tasks, each task efficiently at a time before switching to a new task. So how to achieve multiple tasking? Create a focused block of time to finish efficiently on a particular task. Create work boundaries. In that work boundaries, take off your phones, throw it aside. When you're doing your toric calculations, is one example. Not ask everybody not to be disturbed. Little things that can make you a success. Rely on systems. People fail, systems don't. That's a reality. So make systems. Rely on checklists. Some help. There are various tools which are available to help you multitask. There can be daily planners, Google calendars. There's an app called Trello. There's Toggle, which is a time tracking app which helps you on which multitasking activity you spend maximum time. Multiple optometrists to a single ophthalmic surgeon. This is often the case. Very good way of getting your OPD streamlined. Multiple OPDs for one ophthalmic surgeon. That's also a very good way of maximizing. And multiple interns, residents to one ophthalmic surgeon, often in institutional practices. Multiple centers versus one ophthalmic surgeon, only for the time-trained and efficient practitioners, and multiple OT tables in one ophthalmic surgeon. Again, very common practice. Note, delegation of labor and work amongst your team works better in these situations. So we had one article in one of the very famous retinal physician journals, which suggested the use of script. Now, script are record keepers or record loggers. what they do is they'll make notes of what you're talking or what's happening, and patient notes and everything for you. And they found that the doctor was able to spend more time with the patient and get better results. So in conclusion, multitasking may be asking too much from your staff and you, but sometimes, and when used in the right context by the right people, makes a well-oiled system for success. But otherwise, can be a double-edged sword with less rewards and more regrets. Thank you so much.
Thank you. Dr. Saurabh, your take on multitasking, sir, because you run a single person center. You don't have other ophthalmologists with you. So
Yeah, so I agree to Aditya on a lot of things. That multi-mono thing sounds, it hits you really well. That, doing too many things at the same time at times, can give you and it happens to everybody, missing something on the prescription and maybe then you're calling somebody. So yes, you need to streamline it. You need to prioritize even in multitasking what you need to, do first, and maybe that the other task can take a back seat, as a matter of fact. And yes, I follow some of things what Aditya is already saying, like multiple optometrist, uh, multiple chair units wherein I move on to, so that things go a little faster when you are into a little heavy OPD.
but what about the administrative work, sir? Like, for example, like Dr. Mishra also said that he has a team of 3 people. He
Right.
has accountant, a chartered
So
accountant.
yes, in my case, Rohan, I get a huge help from my dad. Like I'm the second generation now, so dad is not much into practice. Of course, he does practices, but all these things get on are still on his shoulders, like the taxation, like at time management of the staff. So some of the staffs is like way old for last 30 years or other 40 years from the day one of our hospital. So some of these things goes untouched from my end, because hello, yeah, I hardly get to know about a little few things. Now that things are coming on my head, now that he's traveling, he's out, so now I am kind of making my own team, because that whole generation is moving out. Like dad is slipping out, the senior staff, that sister was there, she's also in her early 60s now. So I am creating a next team wherein I'm trying to have my own secretary who kind of runs apart from these ophthalmic appointments and other things, like doing my tickets, all small things. So I am now starting to shed off some load. Okay, some of the important decisions are to be done by me, but of course some petty decisions, some things which probably they can take a call on, or reduce some charges, levi some charges for the patients, give some discounts with a certain limit, of course. So I'm trying to show a free hand to them.
Great. Dr. Mehta, sir, your opinion on multitasking? You are a multitasker yourself and a great one at that.
I guess everybody's personality, but I would get bored doing one thing in life. Multitasking is really great fun. It's fun to do a LASIK, doing a complex phaco, and then getting a detachment done in your life. Same day. It's fun. Believe me, you can't get more variety in life. You can't get it more excitement, the adrenaline flowing. Everything else disappears. All your problems disappear. All your backaches can disappear. Everything can disappear in life. So what he's saying is, yes, you can't do everything, but you have to know everything. Your staff will not respect you. They can take you for a ride if you don't know what's going on. There will be overlapping of duties, and ultimately you have to be the ward boy also in your own clinic. You need to know whether the autoclaving, a sudden test, whether they are autoclaving it well or not. Things on which your life depends. You have to be thorough about it. So you have to look after everything. Very, very important. And there is no escaping multitasking. There is no escaping. Well, the finer tuning of the multitasking business is you can't take 3 phone calls at the same time. Whatever you're doing at that time, concentrate on that mono task. But the eternal fight between mono and multitasking, there is little choice from that. As I said, those multiple balls which are jiggling, and you'll keep jiggling that for the rest of your life. The more you avoid something, the more it will come and hit you. Take my word. And there's a very, very important statement which I make. Your strongest point is your weakest point, and your weakest point can become your strongest point. This is how I would put it across, and you have no choice. You have to get on, especially if you are solo practice. What happens in institutionalized practice, there are many things you may disagree, but you will keep quiet for the larger betterment, or your voice may not be heard. Whereas in your solo, buck stops at you. So you good, bad, ugly, take decisions, and you rather be fast, because the world is moving fast.